A 65-year-old man with a history of hypertension, diabetes, and coronary artery disease has dyspnea, orthopnea, and bilateral lower extremity edema. Examination: he has elevated jugular venous pressure, bilateral crackles on lung, auscultation, and pitting edema in his lower extremities, and his oxygen saturation is 90% on room air. His chest radiograph shows cardiomegaly and pulmonary congestion. Which of the following is the most appropriate initial pharmacological intervention? A. Initiate treatment with angiotensin-converting enzyme ACE inhibitors. B. Start intravenous furosemide Lasix. C. Administer supplemental oxygen. D. Prescribe beta blockers. The correct answer is B. Start intravenous furosemide Lasix. Explanation: this patient has signs and symptoms of acute decompensated heart failure, which is a medical emergency. Furosemide is a loop diuretic that reduces the preload and afterload on the heart and relieves the pulmonary and systemic congestion. A 45-year-old woman with a history of obesity and type 2 diabetes mellitus visits her primary care physician for a routine checkup. She has no complaints and feels well. Her blood pressure at the clinic is 130/80 mmHg. She says that she has been monitoring her blood pressure at home, and it is usually around 160/95 mmHg. She takes metformin and lisinopril regularly. Her physical examination is unremarkable. Which of the following is the most likely diagnosis for this patient? A. White coat hypertension. B. Masked hypertension. C. Resistant hypertension. D. Malignant hypertension. The correct answer is B. Masked hypertension. Explanation: this condition occurs when a person has a normal blood pressure reading in the doctor's office, but high blood pressure at home. It can be caused by factors such as stress, alcohol, caffeine, or smoking at home. Masked hypertension is associated with increased risk of cardiovascular events and end organ damage. Therefore, it is important to confirm the diagnosis with ambulatory blood pressure monitoring or home blood pressure measure. A 32-week pregnant woman presents to the emergency department with dyspnea, orthopnea, and palpitations. She has a history of cardiac illness since childhood and did not receive any prenatal care. On examination, she has a loud pansystolic murmur at the apex, crackles in both lung bases, and pitting edema of the lower extremities. Her blood pressure is 160/100 mmHg, and her pulse is 120 beats min. An electrocardiogram shows left ventricular hypertrophy and atrial fibrillation. A. Peripartum cardiomyopathy. Pulmonary embolism. C. Rheumatic heart disease. D. Hypertensive emergency.